Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder. We are performing the Deuk Plasma Rhizotomy, only available at Deuk Spine Institute, to treat the second most common cause of back pain, which is the facet joint pain. Show us where the pain nerve is, Jordan. All right, look right there. Show us the transverse process, which is a piece of bone that sticks out to the side. Yes, there's a bottom margin and a top margin. You have to follow the top margin right there where it slopes up and to the facet joint. That is called the superior articular process. That is the joint where he's showing you. And right where it starts to slope, right where the tip of my probe is, that's where the medial branch of the dorsal ramus lives. That is the nerve we must destroy to get rid of his pain. And that's what we're doing. Yeah. So that's one down. We're going to move on to the next one. And in the meantime, Henry, show the audience how is it a facet joint causes so much pain?
Of course.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk Plasma Rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that the facet joints can become very painful because they get arthritis in them. And that arthritis causes pain because of inflammation happening in the actual joint itself. As the body is trying to heal, the painful joint, it's trying to heal. The inflammation is the healing part. But unfortunately, when you have so much inflammation, you get a lot of pain. And a lot of times, the body is unable to heal, unable to heal the facet joint because we keep re-injuring it through movement. All right, that's perfect. The tip is exactly where I want it. And I just moved it. Let's check again. That looks really good right there. All right, so you can see the joint that's arthritic. Show them. Up, all that big thing. That's a big arthritic joint. And we are destroying the pain nerve just at the base. There are 2 joints we're fixing, and we're destroying 3 pain nerves. 3 nerves to 2 joints. Every joint has 2 nerves that bring pain from the joint up to your brain, and that's what we're destroying, is those pain nerves, called the medial branch of the dorsal ramus. We showed them already, right? Yeah. Henry?
Yes, we did.
Showed them.
Yes, 100%.
All right, let's make an incision. We're going to go to the left side. Any questions?
Yes, we have a question coming from Faisal.
Hi, Faisal.
On Facebook asking, Doctor, are you treating nerve irritation, neuritis, nerves can be irritated and cause pain, numbness, or tingling even without being pinched or compressed. And this is often referred to as nerve irritation or neuritis.
Yeah, you're correct.
I believe
We are treating that as well, but that's not exactly what you're thinking, probably what I'm treating. So we have a name for that. It's called radiculitis, which is when the nerve root is irritated, inflamed, and the nerve root actually causes pain down the leg or down the arm. It's called sciatica. Sciatica comes from radiculitis of the nerve roots in the lower back. Okay? Shot? Too low, probably. So, give me a second. Shot. Got to get to the transverse process here. Shot. I'm trying to get to the L5 transverse process. I think that should be, keep slipping off of it. Probably its shape is a bit unusual. It's like a triangle shape. That's too low. Shot. All right, I'm on it now. I just have to get more medial. There we go. That should be the good spot. Give me a second. Shot. That's perfect. Perfect spot. You have to get to the right spot to do this rhizotomy procedure. But we're not treating neuritis when we do the rhizotomy. We're treating basically a painful joint called the facet joint. Now we can also do this procedure for other joints. Pressure. Hold on. We can also, let go. We can also do this procedure for other joints, like the knee and the hip. Any other questions?
yes, we have a question coming from Smarzig on YouTube.
Hi, Smarzig. Welcome. We're done.
Asking
Berndes. We're done. Go ahead, Smarzig.
Asking what percentage of patients are you retreating from a prior surgery from another provider?
Oh, yeah, great question. 25% of our patients have had, maybe 25 to 50% have had surgery from other providers for their pain, and the surgery was unsuccessful. All right, you can see how small the incision is for the Facet Deuk plasma rhizotomy. It is 4 millimeters. You guys see that?
Yes, we do.
It's literally 4 millimeters, okay? The laser surgery incisions are here and here, and the facet incisions are here and here. So we treated two different pain sources, facets and discs. The disc accounts for about 85% of chronic back pain. The facet joint accounts for 10%. Together, discs and facets, they account for 95% of chronic back pain. So if you know somebody with chronic back pain and they've had it for, more than obviously 6 weeks, they most likely have disc pain and could have facet pain. Now, when I say disc is 85%, that's the primary cause, number one cause for pain, 85% of patients. The facets are the number one cause for back pain in 10% of patients. Together, 85-10 is 95%. Disc and facet are the number one primary cause of back pain in 95% of people worldwide. There are 820 million people in the world suffering with debilitating back pain. So about 800 million, it's their disc causing the pain and facet. Now, the third most common cause is the piriformis muscle being torn, and the fourth most common cause is the sacroiliac joint. On our website, deukspine.com, you can watch the 30 causes of back pain, and it goes through all of the causes, okay? And shows you also how they cause pain. All right. Any other questions?
Yes, got a question coming from Lanu.
How many more questions?
Just two questions.
I'll come answer them face to face for you guys.
Copy that.
All right. So we're going to show you a nice little testimonial, our most recent one from a patient from last week. And I will come and answer your questions. So type them up I'll come answer them for you. And good morning, I'm Dr. Deuk Majan. 30 years of back pain.
Yes,
Gone overnight.
Yeah, overnight gone. It was amazing. I've been dealing with it, suffering. If it wasn't for my faith and belief and my friends back home that supported me, my wife, I finally got here to the Deuk Spine Institute, and what an amazing experience it's been. Had surgery yesterday. I'm up walking around. I feel great. My pain was usually from a 6 to a 10 out of 1, if that. And I'm just so grateful that there are gentlemen in this world that really care about people like Dr. Deuk, and I can't thank him enough. I recommend this gentleman to anyone who's been suffering and doesn't know where to go for help. You know, I live in the state of Idaho. It's a great place to live, but probably one of the worst states to get hurt in.
Well, we are happy you're here in Florida to get your back fixed. And we did the Deuk laser disc repair on your back and the Deuk plasma rhizotomy on your facet joints. And you had a fusion done before, is that correct?
That is correct.
And we saw in your video when we were doing your laser surgery, you could see all the screws and rods, and you even have a broken screw at L5 on the left side, I believe. How do you feel comparing your fusion surgery with the Deuk laser disc repair?
There is no comparison. 100% different. The fusion didn't help me, made me worse. It gave me a heart complication that I still deal with. But since I've been here, the people are outstanding in this facility, and I can't praise them enough. And Dr. Deuk is truly a godsend for people that are suffering. I can say 100% honesty that I feel totally different person. I'm just so glad that I came here.
How's your wife feel about your new back?
She loves it because she knows I've been dealing with pain and depression. It's a hard thing to deal with. You know, it almost took my life. But like I said, with my belief in our Father and His Son, Jesus, has kept me here.
Amen.
And she's a big part of that. You know, I got to thank my friends like Dave Bowden, Dan Arnold, and Brad Russell. Those are truly my childhood friends that never gave up on me. People judge me on how I look, not how I am. And I'm a very compassionate person like yourself, and I want to help other people. I can't suggest Dr. Deuk and his team here are world-renowned, outstanding, and everyone's so kind. I'm just so happy, you know, to have you on my side, and I can't thank you enough. You know, thank you, sir.
Praise God.
Amen.
And thank you for having faith in my team and our ability to help you.
Yeah, it is. It's they're, like I said, they're world-class people here. You can't go wrong. At least for myself, I'm just ecstatic. It's, you know, can't put it into words when you have no pain. I love it, and I'm just so glad that everyone helped me who was involved with me getting here, because I didn't do it on my own. I thank you all.
Well, thank you for sharing your story. I know it means a lot to people out there. We just want people to know that we can now fix back pain, neck pain. They just have to come here to Deuk Spine and get the right treatment done, and we'll help them tremendously. Enjoy your travels home.
Yep.
And enjoy your new back.
And I shall. Thank you so much.
Yes, sir. It's my pleasure. All right. I'm here with one of my post-op patients. We get a lot of requests for Dr. Deuk. Can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Deuk laser disc repair done at L3-4, L4-5. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now, you had your surgery done here at Duke Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Duke Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3-4-4-5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy, it
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision,
Yes.
outpatient. There was no bleeding,
And no pain from the surgery.
no pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery. I called to make sure. Are you sure? Because I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No.
Amazing. Well, thank you for sharing your story with us. And you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome. And good morning, Dr. Deuk Majan. It's July 17, 2024. I'm here with one of my Floridian patients from Punta Gorda. He just had his lower back fixed with two procedures, the Deuk laser disc repair for some bad discs and the Deuk plasma rhizotomy for facet joint pain, which we discovered when he showed up here and I examined him and found his facet joints were hurting him. You just had your surgery yesterday. You can see in the video, we went in and cleaned out two discs and got the pressure off the nerves. We also did the Deuk plasma rhizotomy on your facet joints and destroyed the pain nerves. How do you feel today?
I feel good. Yeah, I don't have any pain.
So the surgery helped.
Oh yes, surgery definitely helped. Yeah.
What was life like for you before the surgery? Why did you decide to have it?
I couldn't do anything. I couldn't walk. I still try to get around a little bit because I'm general contractor and I try to help my son out. I help the last, I'd say 6-8 months I've been in my chair and that's it. Watching TV and that's about it.
Because of the pain in the back?
Because of pain and yeah.
And you've had a rough time because you had some fractures in your spine which had kyphoplasty cement put in, which looked good. And then the discs were the problem now, as well as your facet joints. And we were able to fix those yesterday.
Yes, I went to a different doctor over in Fort Myers who did the cement jobs. I thought that's all I needed. That's what one doctor said. Oh yeah, you just got these 4 fractures, I guess.
Yes.
Yeah, we'll fix that. You'll be fine. Well, it didn't do anything when he fixed that.
Well, and now you notice a difference.
Yes, definitely.
And you're not on any new pain medication that we gave you.
Well, I haven't taken any pain medicine.
No pain medicine.
No.
And you're still feeling like the pain is gone. So yeah, I believe it worked well.
Yes.
Anything you want to say to your friends or family out there?
No, I'd definitely recommend Dr. Deuk for someone who has a back problem. Certainly, this disc laser surgery, I guess, he's the only one that does it. Seems to be the best way to do it. Like I say, I would recommend it. And a matter of fact, I have a cousin that has been having problems for quite a while. And when he gets back down here, he's coming back to Florida. I'm going to have him call Dr. Deuk, see if he can set up something.
Yeah, we'll take care of him. Don't worry. What's his name?
Kent LeDuc.
We'll look for Ken Leduc. All right, sir. Well, enjoy life. Get those muscles back in shape. If you need anything, you call me. You have my cell phone.
Oh, thank you very much.
You're welcome.
Yep, thank you.
You're welcome. Thank you. Oh, I hope you enjoyed that testimonial as much as I did. And I'm here with my man, Henry. and I
Hi.
will take your questions. But we just finished up. I'll just show you for those people interested, fixing 2 discs, and I'm missing my little pointer, so I'll have to use my pen. There it is, over on my Deuk spine cup.
Oh, yeah.
You see the little paper clip
I
there?
see you. There you
Perfect.
go.
All right.
Perfect. I was looking for
So we talked about how the disc is the #1 cause for back pain, chronic back pain, as opposed to acute, which is chronic just means you've had it for more than 6 weeks. So acute back pain, you could fall off the roof, have pain. That's called acute. We're not talking about acute pain. The cause of acute pain is usually obvious, but chronic pain is what people live with for, a long period of time. The #1 reason is the disc. So we went what's called transforaminal. Forget about the metal. This is one of our spine models. I came from the back side and I went through the hole that's already here right into the herniation. So the only damage being done is a cut on the skin. Everything else underneath the skin is being spread gently and spread apart, and then it comes back together like an elastic band when we're done. And then we enter the herniation right here. So that's really what we're doing, okay? Then we treated the facet joints. To do that, you go where this transverse process meets the superior facet right in that corner, and we burn the pain nerve right there. Okay, so that's what I did. We did 2 procedures. We had 2 streams. This stream right now that you're watching is the facet joint because we finished the disc earlier. And I understand we have some questions.
Yeah, yes, we do. This first one is coming from Lanu on YouTube.
Hi, Lanu. Nice of you to join us. We have some regulars here, which are really nice.
Of course, we have some regulars and some news, so not complaining at all. Coming from Lanu once more on YouTube asking, some medical schools seem to have a hidden agenda. They brainwashing the students by not allowing alternative views. Are medical students influenced by pharmaceutical and insurance?
That's a great question. That's a really, really, really good question. Yes, I believe they are. Unfortunately, so I went to med school back in 1993. 93? So what is that? That's like 32 years ago.
Yeah.
I went to USC med school 32 years ago. At that time, there was no outside influence in medical education that I'm aware of. When I look back, it was pure, just good teachers, really smart teachers wanting to teach the students medicine. And the curriculum for medical school was very well developed. USC, where I went in Los Angeles, one of the top med schools in the world, they had very good textbooks, very good lecturers. They were experts in their fields, and the content that they taught us was relevant to medicine. And there's a way to teach medical students where you teach them certain classes the first year, different classes the second year, but the second year classes build on the first year classes. And then the third year, you're in the hospital on different services, taking care of patients and learning those services like OBGYN or pediatrics or neurology. And I thought that the curriculum was excellent back then. Nowadays, I don't know what the influences are in medical school, but there are very strong influences after medical school once you've selected your specialty that you want to train in. And in neurosurgery, we have 7 years of training at about 110 hours a week in the hospital working on average. So 7 years times 110 hours a week, that's a lot of time in the specialty working. There are definitely outside influences, and it depends on the specialty that you're in. For example, in OBGYN, there's a thing called a bladder stimulator. A lot of women are getting these stimulators put in. Now, the company that manufactures those stimulators is making billions of dollars profit selling those stimulators. I know lots of women who have them put in, older women generally, who have urinary incontinence, and these stimulators go in and they don't work. And so they're getting, what's happening, if you step back and look at it, the patient's getting a surgery that doesn't work, but they're taking it because there is no other option that works. And they have hope that it's going to work. So they do this surgery and they expose their body to the risk of surgery in the hopes that they have more control over their bladder. But in the end, what's really happening is they're not getting any better control of their bladder. It doesn't work. And the doctor's getting rich, the surgery center's getting rich, the hospital's getting rich, and the company selling them is getting rich. And honestly, these devices don't work. So we're in a situation now when you look across fields, whether it's OB-GYN, whether it's neurosurgery, whether it's spine surgery, just take your choice. There's all this technology companies that are basically owned and controlled by people who just want money, and they don't care if their technology works or doesn't work, namely because nothing else does work. And so why not have something else that doesn't work with everything else that doesn't work? You don't feel bad about it if it doesn't work. So you're putting these expensive devices in people that don't work. What we need to do is we need the Doge to come to medicine and meet with me and talk about some of these problems in medicine that we're spending billions and trillions of dollars a year on these treatments that don't work. I could literally save our government probably $1 trillion a year in healthcare costs just in the spine world and pain management world alone. But nobody comes to talk to me because they know everything already. They know everything. Even though we have 10,000 videos on YouTube with spine surgery, I guess they still stick their head in the sand for some reason. So whatever, you know. You can lead a horse to water, but you can't make it drink. Great question.
I like that. Yes, next question coming from Hassan on YouTube, asking, hello, doctor.
Hello, Hassan.
Asking, I hope you have a wonderful day.
Thank you.
What,
You as well.
what advantage does this technique give over facet joint steroid injection?
Yeah, great question. So facet joint versus the Deuk plasma rhizotomy. So a facet joint steroid injection, you're taking a needle, you're sticking it down to the facet joint, and you're trying to inject steroid into the joint. First of all, it never goes in because the joint's full of arthritis, it's collapsed, it's full of scar tissue, and you try to inject the medicine in the joint, it doesn't work. So you end up injecting the medicine around the joint, and of course, what's going to happen? It wears off. Whether you get the medicine, the steroid in the joint, or you get it around the joint, along with the numbing medicine that's there, it gives the patient temporary relief, maybe for a few hours or a few days. Our procedure permanently destroys the pain nerve. The effect is permanent pain relief for the rest of their life. That could be 30 years, 40 years of pain relief, not 5 days of pain relief. Deuk plasma rhizotomy is the best treatment in the world for facet pain, actually for arthritic knee pain, hip pain, shoulder pain, fingers hurt, wrist hurts from arthritis. This Deuk plasma rhizotomy that I invented is the best treatment in the world because it's the least invasive, it's safe, and the result is permanent pain relief from the painful joint.
And then coming from Scott on Facebook,
Hi, Scott on Facebook. Welcome.
asking, part of the MAHA movement, Make America Healthy Again movement, should be to have RFK Jr. do a colonic on insurance approvals on outdated / poor outcomes procedures versus updated / positive outcome procedures. What are your thoughts? P.S. I voted for you to be on that panel.
Hey, thank you, Scott. Yeah, I think you're right. You know, the thing that bothers me the most, if you think about it, all right, so we've got all this waste in the government, right? In the Federal Reserve and IRS, whatever. You pick your department, okay? Tons and tons of money being wasted. But healthcare is different. Why? Because not only are we wasting money like everywhere else, but people are being harmed while we're wasting the money. You see, other places people aren't being harmed, right? If you have Sesame Street in Iran, it's not really hurting anybody. Yes, we're taking money and wasting it. I agree, but it's Sesame Street, right? It's not hurting anybody. But when it comes to health and all these procedures that are being done that are hurting human beings, hurting Americans, and the rest of the world does what we do, by the way. So if we're sticking steroids in people, if we're giving pills that never fix the pain, if we're doing laminectomy surgery that just makes the spine weak and unstable, so patients end up needing more surgeries and treatments, those treatments hurt people.
Mhm.
And that bothers me as a doctor. We are supposed to be doctors who don't hurt our patients. And yet everybody seems to have thrown that out. They don't give a shit about that principle. And they're just all about do as much as you can to get as much money as you can. And yes, we need an overhaul of the system. I agree with you. I would love to be part of it. I know where all the waste is and where all the harm is for patients in the spine field. Okay. I'm not an expert in cancer treatments. I'm not an expert in, urological procedures, urology procedures, or OBGYN. But I'm an expert in spine and pain. And I could be very helpful in that realm. And I would love to help. I mean, I could literally help millions of people get out of pain if they just listen to me.
That is it for questions.
Okay, that's it for questions. Thank you so much. We do have another surgery being lined up. The patient is on their way to the operating room, and it's another patient from Virginia.
Hey.
We have 2 patients in a row from Virginia. This next patient, he has a gigantic herniation at L4-S1.
Yeah.
He also has a piriformis, and he has facet pain.
Mhm.
So we're going to be doing all 3. I'll be right there, thanks. And we're going to split it up into three broadcasts. So we'll do the disc first, then we'll do the facets, and then we'll do the piriformis release. So we'll get 3 surgeries out of this patient. All right. Thanks for joining us. It's been a pleasure as always.